It is a pleasure to meet you. I am from Stepi, Il-Yongcheong. First of all, I would like to thank you for giving me the opportunity to present at such an important gathering. Today I'm going to talk about the future of Korean digital healthcare industry, challenges and potentials, in particular the future vision of healthcare amidst COVID-19. And then I'm going to go on to trends in the digital healthcare, challenges in South Korea, potentials for South Korea. I think that healthcare is a very broad concept. It is disease treatment, health management, and in this area, various devices are being used. And I think that data is the main infrastructure for digital healthcare. There is healthcare data from electronic medical records and personal health records and the genetic analysis information. And also there's also national health information from public agencies such as the Korea Health Insurance and also HIRA. And the digital healthcare industry is expanding. In the past, we just talked about mobile health and precise healthcare and wearables, but these days we are talking about digital therapeutics and telehealth. In Korea, this year, Stepi conducted healthcare as a future vision technology, and therefore we looked at the vision of healthcare post to COVID-19. So what will be the future of our world? And we wanted to view COVID-19 as an opportunity for innovation. And we need to think about what our future will be first of all. We worked with experts in Korea and we carried out a workshop to assess what will happen in 5 years and 10 years. And we identify 14 events of the future, and we thought about what types of futures would be acceptable. So these are the future events in the healthcare industry: real-time healthcare management, and so there will be damages of data leakage, and due to telehealth, there was some events that the people thought of medical minimalism and that healthcare will reduce. And due to COVID-19, we talked about the new insurances, so national new insurance coverage for infectious diseases. And so we carried out a survey with 1,000 people in Korea and 1,000 people overseas. And there was a high preference for real-time healthcare management, and it's also very feasible. And so the domestic survey results showed that there was a preference to close the gap in the health sector. And the reason why we carried out this survey with overseas person was because we felt that there are global health issues, and about most of the surveyees were from India and USA, and we saw from the overseas survey result that a preference for enforcement of the National Infectious Disease Protection System. Up until last year, managing healthcare with real-time data, there was a controversy because of the privacy issue, so it was a difficult issue. But due to COVID-19, on the digital healthcare, we see that there will be a lot of acceptance, and so that is one of the expectations that we have. On the digital healthcare, by 2020, so this was the year that this industry received the most amount of funding. The biggest investment was made in 2020 since the past 10 years. So many industries are undergoing seismic changes, and there have been negative impacts. But for the digital healthcare, it is leading to a breakthrough because of COVID-19. The first one is telemedicine, and WHO defined that the delivery of healthcare services when and distance is a critical factor from the diagnosis, treatment, and prevention of disease and injuries. That was the broad definition by WHO. And the reason why I'm showing you this picture is because when we think of telemedicine, we only think about teleconsultation, but there are many other areas such as telemonitoring, nursing, and diagnosis, education, administration. And it's not just phone calls, emails, text messages, and you can even use chatbots. In 2020, August, the largest telemedicine company, which is Teladoc, merged with Live On Go at a price of $18.5 billion. Teladoc was one of the largest beneficiaries of COVID-19. There was a gap in the medical service that could be provided, and UnTAC service was provided, and there was an explosive growth therefore for Teladoc. And in the case of the United States, most of the medical staff had to focus on dealing with the COVID-19 patients. And so there was a gap in the healthcare service that you could receive for those undergoing chronic diseases and minor diseases. And so there was this big event this year of these two companies, Live On Go and Teladoc, merging. And if you look at artificial intelligence and machine learning, there was development pre-COVID-19. In particular, radiology and cardiology were areas in which FDA approval was received. And another hot area is the digital therapeutics. Up until now, other than like receiving injections or medication, that was most of the therapeutics. But now there's also digital therapeutics. This child undergoing ADHD can receive treatment by playing this game. So it's a software. And in 2020, first half, in the U.S., there are many products that are receiving FDA approval for such products. And D2C genetic testing, this shows the 2019 data. In early 2019, it was more than 6.3 million, and 23andMe as 12 million were their users, and 80% of them said that they agree to 23andMe utilizing their genetic data for research. So now they have a 10 million amount of data that they can use, and you see that Black Friday, you can receive such discounts to get to genetic testing. And I think the business model can be divided into three, providing genetic tests and utilizing the data. It can be used for new drug development and therapeutics. And a good example will be GSK in 2018. They have a 4-year exclusive data usage, and they invested $300 million into 23andMe. And 23andMe developed a new medicine, and they exported their technology to Almira. And this is a very hot industry that's developing these days. And another example is medication delivery. The reason why I'm showing you this is because for telemedication, you need to have medication delivery. Let's say you had a remote consultation, and if you will have to go to a pharmacy that is near that hospital, it is not possible. So it needs to go together with the medication delivery. And PillPack was a U.S. startup. And our parents' generation, they take not just one pill, but they have to take several. And in some cases, they need to be administered with one pill per day, others 3. Therefore, it's quite complicated, and it's not easy to comply with the administration rules. And so the medication is sorted, and information about this is combined, and it is being delivered to the consumers, which leads to better compliance to the administration schedule of the drugs. And PillPack was acquired in 2018 by Amazon. Then let's look at the situation here in Korea. Korea has a very sophisticated ICT infrastructure, and we have a lot of smartphones. So overseas, they have high expectations for telemedicine in Korea. And we are receiving requests about the level of telemedicine here in South Korea. But to explain about Korea's digital healthcare, we have a high level of regulation, and that is why many companies are struggling in this area. Just on telemedicine from 2002 up until 2019, many laws have been raised and they were discarded in 2020 due to the spread of COVID-19. We are providing telemedicine. It was temporarily allowed. You might think that this is a great development, but although we discussed this for the past 10 years, we realized that we were not well prepared. As a researcher, I realized this. And there is a very limited, narrow interpretation of Article 34 of the medical law. Therefore, this Article 34 needs to be revised. And I told you that AI and machine learning devices have received FDA approval in the United States. And likewise, in Korea, there were 53 devices that were approved by Korea FDA. But these devices, they were just approved. They were not put into the one of the items in which will be covered by the national insurance. So it has to be connected with that. And for the D2C genetic testing is under regulatory sandbox. Therefore, temporarily, there were deregulation, and that's why it's being provided. There are a couple of companies that provide this service. However, the consumers don't feel that the level of service provided is sufficient enough to make that purchase, and that's why it's not growing. For digital therapeutics, it's in the initial phase, and the KFDA released digital therapeutic approval and review guidelines in August of 2020. So we now have these guidelines. And on the medication delivery, it has to be discussed with the telemedicine at the point now, but it's not discussed yet, and it is still illegal. I carried out a survey on the regulations that need to be improved for new drugs and new medical devices in Korea. So the highest respondents, the biggest number of respondents said that there has to be some expertise in regulatory examinations. I am a researcher dealing with the medical data, and when I received this theme to speak on this item, although I'm not a specialist in this area, I decided to give a presentation on this because I wanted to provide my praise to the struggling companies in this area. For monitoring, telemonitoring, it was a bit ambiguous according to the regulations whether it was approvable or not. And in the beginning of this year, the Ministry of Health and Welfare, they said that telemonitoring is possible. And so it seems that it will be possible going into the future. And for telemedicine, it was allowed for a certain period, and Medi here announced their product to speak to a Korean doctor. And there are many other companies involved in telemedicine, and these companies have a global level of technology. Not only this, but they are working with hospitals. They're working very closely in order to verify the usability, and if there is any additional demand in the hospitals, they are identifying that. Therefore, I believe that this industry has rosy prospects in the future. And on digital therapeutics, none have been approved yet. However, Life Symantec, they have red pill care, and there's also another company, Welt, that this is a fall prevention smart belt, and about 10 companies will be launching a digital therapeutic related approval documents. They will submit this to receive approval. And in Korea, the DTC genetic testing, it's very limited in what you can receive, but 3 billion, they can provide testing for 7,000 rare genetic diseases, and it's a service that is being exported globally. And Human Space is a company that provides personal health records via blockchain. And for my information, if there is a pharmaceutical company that needs such data, then they can purchase it, and I will be receiving tokens in return. So Korean companies are working hard in this area. And the government is also carrying out a bio big data project to support the development of new drugs and medical device products and the digital healthcare industry by analyzing numerous data. And digital healthcare, it grew explosively, and the categories are really expanding quickly. It's not just about the devices, therapeutics, and medication, so the areas are expanding. And in digital healthcare, what you need to understand is the usability of the products and services. Wearable devices, even if you start using it, if it's not comfortable, you won't use it. And the software, games too, it has to be usable, and you may think that this technology will lead to good products and services. If you start from the technology, it will lead to failure. Therefore, you need to flip it around, develop your products starting from the consumer's pain points. And on the regulations, the technology is developing so quickly, therefore the regulations will need to be flexible, and there has to be regulatory harmony. Also, it has to be included in the structure of medical cost in the medical insurance system. I think that ICT skills and also the healthcare industry need to work together to lead to innovative digital healthcare. And for this to lead to tangible results, we need regulation and institutional support. If such regulation and institution support is not provided, then the Korean startups will not start their business in Korea. They will go overseas, which will mean that Korean consumers will not enjoy the benefits of the digital healthcare. And another unfortunate thing is that many digital healthcare startups, they are not targeting Korea. They are already targeting the U.S. market first. And as a policy researcher, when we look at digital healthcare, we would like to see a more active review of the regulations in this industry. And with this, I would like to conclude my presentation. Thank you for listening.